Julia.
Hey, come in.
Hi, my name is Sydney. I'm a student nurse today. I'll be assessing your cardiac and your respiratory today. Can you verify your name and date of birth for me?
Reagan Newton, May 15, 2001.
Okay, can I check your arm just to verify? Perfect. And I'm going to do my hand hygiene. I'm going to close the door for privacy. And Reagan, we already checked your BP earlier, which was about 118 over 64. Does that sound about normal for you?
Yeah.
Okay, and then are you in any pain today?
No.
Okay. So we're going to check your cardiac and your respiratory. I'm going to ask you some questions first, okay? Do you have any history of heart disease or heart problems in the past or in your family?
No, I haven't.
Okay, and are you having trouble breathing of any kind right now?
No.
Okay, and do you use anything at home to help you breathe or anything? Do you use any kind of assistive device?
No, I don't.
Okay, when you cough now, when you cough, do you have dry or wet kind of cough? Do you come up with any sputum or anything?
No, I haven't been, I don't have that right now.
Alright, that's great. Okay, and then I'm going to check I'm going to listen to your heart and I'm also going to listen to your lungs, okay? I'm going to have you sit up for me. I'm going to clean my stethoscope with alcohol wipe. Alright, I'm going to go to the second intercostal space, which is in the mid-cardial line, and then go down to the second intercostal space, and listen to her aortic on her right side. I'm going to go across to the pulmonic, to the second intercostal space on her left side. I'm going to go down to her urge, which is in the third intercostal space. And then I'm going to listen to her tricuspid, which is going to be right here, and down this area, sorry. And then I'm also going to listen to her mitral, which is right under. Do you mind just lifting it? Thank you. Okay, and all your heart sounds are normal, S1 and S2. I don't hear anything that's abnormal. And I'm also going to listen to your lungs, okay? And I'm just going to point out that I didn't use a bell, since you told me you didn't have any history of heart problems in the past, so let's skip that part, okay? Okay, I'm going to listen to your right upper lobe for your lungs first. You take a deep breath. And then can you take a deep breath. I'm in her left upper lobe. Now I'm going to go down to her left lower lobe. Take a deep breath. Thank you. Now I'm going to the right middle lobe. Deep breath. And then I'm going to the right lower lobe. And take a deep breath. Okay. All your lung sounds clear. And then I'm going to listen to the back too, okay? If you don't mind just turning this for me. Take a deep breath. And take a deep breath. Take a deep breath. Take a deep breath. One more time. One more time. Okay. All your lungs are clear. I'm gonna just check where your pulse is, okay? So I'm just pointing out her carotid pulses are right underneath her jaw right here, and then her axillary pulse will be kind of right underneath her armpits, and then her brachial pulse will be right here, which is kind of in the crease of her elbow, and her radial pulse. I'm gonna check for your radial pulse too, okay? And it would be right here on the thumb side. Okay. Now I'm just gonna check your pulse, okay? For your pulse, I got about 72 beats. It is kind of irregular, so I did a full minute, but it was still kind of lower than that, a little bit low, but it's not that good, but it's still in the range. Okay. And while I was feeling your radial pulses, it was +2 and it was normal and how do I say it? It's +2 and it's but not bounding. Okay.
Okay.
All right. It's +2 bilaterally. Just gonna say that. Okay. Now I'm gonna feel. I know your femoral is gonna be right kind of between her thighs, right here, and I'm gonna. Her popliteal is right behind her knees. I'm also gonna feel for any edema. I don't feel any swelling or anything. I need to check your edema up there, but I'll wash your hands first before I go back up there. And then her posterior tibial. It's kind of hard to find hers, but okay. Which is like near inside where her ankle is. So it's would be about +1, and her dorsalis pedis, which is on top of her foot. I give that about +2 bilaterally. Okay, I'm gonna wash my hands. I already felt for your edema and all that down here, but I'm just gonna feel up here, okay? I don't feel any swelling or anything. And I'm gonna check your capillary refill. It's less than 3 seconds, okay? And then I see that you have some stuff on the floor. I see your laptop is plugged in. I would just say just be careful, not to just be careful where you're walking, and just make sure it's kind of tucked away so you don't trip on it. And I see you have some stuff on the floors again. Just be careful about where you walk. And I see you have kids, so just make sure to kind of push things to the side or clean it up just so you don't trip on anything. And then I also, since you do have a kid, I do also see you have these safety plugs for the outlets, which is great. So it keeps them from, electrocuting themselves. And then trying to see what else you could probably do. Oh, you do. I see you have wood floors. I would recommend some grippy socks just to prevent slipping and sliding around. And then I don't remember if I saw any street lights when you came in and all of that, but at nighttime I recommend keeping your lights on outside just so if you do go out and stuff, it's easier for you to see, to make a pathway for you, okay? And I think that's basically it. Oh yes, and then for the are you using an incentive spirometry right now?
Yeah, I started using it.
Okay, and okay, I'm just gonna let you know that when you use it, just to you're gonna you're breathing in first. You're gonna breathe in into I'm gonna cut this out, but I know what a spirometer. Did they teach you how to use a incentive spirometry?
No, not yet.
Okay, so when you use this incentive spirometry, what you're gonna do is you're gonna suck in as hard as you can, or breathe in and hold it for as long as you can. And you're gonna do that. I think it's every hour to just check it. And what I do is it just helps with preventing your lungs to partially or fully collapse after you have surgery. And that's it. Did you have any questions about it though?
No, I'm okay.
Okay, and then I think I already asked you about pain, correct?
Yeah.
Okay, and then was there anything else? Oh, I need to check for your respiratory.
Okay.
Okay. Oh. Okay, I got about 10 breaths per minute. Use pretty slow. Are you on anything that kind of slows down your breathing, or is it something that you just that you
It's
do
just
when you're not
my,
paying
usually
attention?
my normal breath rate.
Gotcha. Okay. All right. And did you have any other questions or concerns?
No, I'm okay.
All right. Well, I'll let the doctor know and have a nice day.
Thanks, you too.
Already did my hair hygiene.